Okay. Okay. Good afternoon. I am Suzanne Silverstein, a member of Northeast Village. And today I'd like to introduce our speaker, Robynn Pease. But first, I'd like to say that as I've aged, I've noticed changes in my health and situation that have required adaptations. And I've realized that a change could slowly develop or possibly happen suddenly, so that I might want or need to move from the house where I presently live to a place that provides supportive care. And that's why I'm delighted that the village is creating a series of presentations to supply us with information about various housing options. We are pleased to begin this series with our speaker, Robynn Pease. Robynn's career includes long-term ombudsman and aging services program administrator in Lexington, Kentucky, and then in Oregon in Corvallis. She served on several advisory councils dealing with senior services, caregiving, and hospice and palliative care.
Yeah.
Currently, she is an organizational ombudsman at the University of South Carolina in Columbia, South Carolina. Today, she will provide us with a framework for when to consider supportive housing options, an overview of the types of living arrangements that are available, and checklists for what to consider when selecting the kind of supporting housing that works best for you. And now I'd like to welcome Robynn Pease. Robynn?
Thank you very much for that introduction, Suzanne, and thank you, Terry, for the invitation to come and speak with all of you. As Terry and Suzanne mentioned, you all wanted, or it might be helpful to start the series with sort of that high level macro perspective in all the different kinds of options that might be available to you. So having said that, today we're going to be talking about this idea of aging in place. Like Suzanne said, you currently live maybe in your own place, but there may be a time when you might need to consider inviting into your home additional care or finding a place that combines supportive care and housing. So I want to share with you the different options that are available to you, particularly in the state of Oregon. Give you sort of a high-level view or really highlight for you the differences between the various options, and then provide you with consumer checklists for each of those options. And what I mean by that is when you're looking for that kind of care, I want to arm you or to give you the kinds of questions, the kind of information that will help you make the best selection for you, as well as some additional resources. There is no need to write things down from my PowerPoint slides. They are intentionally rich in text. Rather, Terry will provide you with the presentation slides at the end so that you can have them on hand as you need them. So let's talk about this idea of aging in place. Most Americans live and want to live in their own homes. It could be an apartment, could be a single unit dwelling, but most Americans want to live at home. And when surveys of older Americans are done, usually the vast majority of individuals in older age want to live at home as well. However, in those kinds of surveys, almost 50% recognize that at some point, as Suzanne mentioned, there might be a time when you'll need to combine some supportive care as well as maybe even make a move. But we know that making a move can be very difficult. And I think there is, in my experience working in aging services, working with caregivers, even studying gerontology, there are psychological barriers to making that move. We don't want to think about it, but we may not have the information. And when we think about we may not want to think about it, it's just, grappling with that idea that we are becoming maybe more dependent or we're nearing the end of our lives. And that shows up in a lot of different ways where people are very reluctant sometimes to look at it. For example, in my family, I have elderly parents in California, and we don't talk about these things. If we're going to talk about their preference would be, like many, to spend the rest of their lives in their home, which they've lived in for several decades now. And so if we're having that conversation, my brother and I have to be very, very intentional. And usually he has to do most of the talking because my mom just does not like to listen to me, right? The older daughter. So in contrast, I have one son. I had him late in life. And so, because I know this about the aging process and about how people are, I have always intentionally let him know where I would like to live, if needed, in my elder years. And I've dropped these hints very lightheartedly, sometimes intentionally throughout his life, with the intention that I wanted to let him know that I wouldn't be afraid, for example, to go into assisted living. And this is in contrast to many of the caregivers I've worked with or even have visited with in long-term care facilities where their mothers and fathers and other relatives have asked them to promise not to put them in that nursing home. But given the options that were in their area, given the intensity of healthcare needs, sometimes that promise cannot be fulfilled. So in contrast, for example, just a couple of weeks ago during the holidays, my son and I were shopping. I bought him some stuff for travel. It was rather expensive. And he said, Mom, this is way too much money to spend on me. And I said, don't worry. When I'm in the nursing home, I would come and visit me and bring me fresh flowers. And I just made it very light and just a little everyday comment as a way to communicate to him that I'm aware of what the options might be. I will take some initiative and I'm not afraid to move where I should. However, at the same time, I have been looking over my retirement funds. They're not they're not very large, and I'm realizing now another barrier that many Americans face when considering housing options in later life is simply the financial means to do so, right? The financial means to do so. So in this presentation, we'll talk a little bit about price range, and we can certainly talk about the different ways that you can shore up your sort of create a financial package, if you will, of programming that could allow you to make that move, even if you don't have a lot of private funds. Okay, when we're thinking about um, the different kinds of considerations that one should take into account when making or considering a move, these are the indicators that I invite you to pay attention to. First of all, the social network. It's really important, and many of you in the village already have, I imagine, a nice or rich or important informal network of family, friends, housing managers. Well, the housing manager might be more of a formal support, but a combination of people who can assist you so that you're able to live comfortably in your own home. This is very, very important. And oftentimes we'll talk about a natural occurring retirement community or NORC. You might even have that handy as well, so that you're very comfortable and the quality of your life is good as you are able to rely on your social network. A second indicator is transportation. As we talked about, looking at regional programming, city level programming, transportation tends to be the number one barrier for people to living at home in a good way. Again, transportation is often very limited. So if you find that the inaccessible transportation is limiting or diminishing your quality of life, making a move to another kind of care housing facility might be a good idea. Safe neighborhood, we want you to be safe. And home modifications is also an indicator. If you need to accommodate a wheelchair or a walker, are you able to comfortably and safely modify your home to adjust to those changing needs and those assistive devices? Also, home and yard maintenance should be considered. When I worked in aging services for the Lexington Fayette Urban County City Government, and I got calls all the time from residents living in the community who were concerned about their elderly neighbors living alone, unable to keep up with the yard work and trash. This not only was an eyesore, but more importantly, there became fire hazards as well as rodent problems because of the inability to keep that up. Yet the reality is, by law, people are allowed to be as independent as possible. We don't want to assume guardianship over anyone unless there is an absolute clear demand or clear evidence of significant cognitive decline. So the ability to tell someone to clean up becomes sort of convoluted and difficult given the minimum number of ordinances. I know in Multnomah County, where you all live, for example, there's some wonderful programs about that deal with hoarding and other kinds of interventions available if that is something you're seeing in your neighborhood. But nevertheless, if you're unable to keep up with that, then maybe moving it would be another a way to address those issues. Physical and medical needs for sure. The onset of those might necessitate or encourage you to seek not only in-home care, but eventually a housing option with care that we'll talk about. And again, certainly, what kinds of financial means and budget do you have and do you need to project as you're thinking about the accommodations you want to make in the future? So let's talk about the continuum of care. So in my mind, when we're doing that overview, I'm thinking of the least, the kind of care that can be given in the home, and then the kind of care that can be given at the very, very end of life, and then the combination of housing and care in between. And so these are the options that we are going to be talking about today. I mentioned palliative care and hospice care. However, we won't go into depth about that because I know you'll be having some presentations and going into more detail at a later date. So the first line of intervention is this idea of home care. And the takeaway for me, if you're unfamiliar with this concept, is simply there are two models of care. There's the non-medical and the medical model of in-home care. The non-medical model is like in the Portland area, something like Visiting Angels, which simply provides you with the personal care. The grooming, maybe some meal preparation, could provide you some of those basic care around your activities of daily living, as well as some of those activities associated with your instrumental daily activities of living, such as assistance with transportation. Usually you have to buy in a minimum number of care hours per week. The range can be anywhere from $20 to $40. That's again a ballpark figure. You can also, in the state of Oregon, go to the Home Care Commission, oregon.gov, and hire from a list of private caregivers to people who will come in and provide care for you. So you don't always have to go through a company, but going through an agency might be very useful if you're looking for continuity of care, that an agency would be better to provide as opposed to just hiring someone individually. It would be your choice. And then the medical model is usually associated with maybe rehab after surgery. You need a nurse to come in and check your vitals, change your band-aids. And as we know, oftentimes when it's associated with health medical care, that Medicare and other kinds of insurance could cover that cost at least for a while. So let's imagine you are having trouble with home maintenance. You're living alone. The yard work is too much. You need maybe a more modest place to live. You might consider independent senior housing. And there is such a variety of what can be umbrellaed under that. Everything from affordable housing that's maybe HUD subsidized for seniors, where you're paying a percentage you're paying for rent based on your income and medical care, to for-profit, robust, elaborate facility that provides multiple dining options and organized activities and maybe some basic transportation services. At the end of the day, this is going to be a contractual type of setting, a type of arrangement. So here you really want to pay attention to all the services that are available and whether or not those services are going to cost extra. For example, is it going to cost you money to do your laundry on site? Is it going to cost you to take the community bus that's provided once a week to go and do some shopping at the mall, et cetera, et cetera? So, and then you also want to pay attention to whether or not this matches your own particular lifestyle. And then cost can be anywhere. I've just ballparked it for Oregon, $3,000 or more. So there's a lot of variation in what you might choose, as well as knowing that you're not going to be able to receive any kind of assistance with activities of daily living. However, you might most likely be able to hire that into your housing unit if needed and when needed. Oregon also has a number of adult foster care homes available for your consideration. These are private residences throughout the state that are able to take in up to 5 non-related individuals and provide basic assistance with activities of daily living and instrumental activities of daily living. This is a really good option for people who are not neurodivergent or have some physical disability and living with who would enjoy a home-like setting. These tend to be more affordable because the proprietor or the of the facility can set the prices. You may or may not have the option of sharing a room or having your own room. Again, the room and board atmosphere is really determined, set by the person who owns the home. And so you want to make sure that that home-like setting aligns with what your tastes. Also, and we'll talk a little bit more about long-term care. One of the advantages of an adult foster care home is that this is considered long-term care. So there's a certain amount of regulatory oversight that can protect you as a consumer in assuring quality of care. I once worked with a caregiver. Her mom had a significant amount of dementia, but none that threatened her wandering throughout the neighborhood. The caregiver, the adult daughter, had her in assisted living, but her mom was very adventurous and very flirtatious. And while the facility was very accommodating, the daughter decided ultimately to put her in an adult foster care home where she was only with 3 women. And it was just a much more manageable setting. It wasn't as overwhelming as a larger assisted facility was for her when it had to do with her building relationships and interacting with others. So it could be an option for you for a variety of reasons and considerations. Along the lines of adult foster care is assisted living. And would like to invite you to be mindful that there are nonprofit assisted living facilities and for-profit. Oftentimes, when you are working with a nonprofit assisted living facility, they are mission driven. And for example, I served on the advisory board of one in Corvallis, where the intent of the mission, the values of the assisted living facility or assisted living facility was to have as many Medicaid sponsored beds as possible, right? So you have private pay and Medicaid, right? But they wanted to make sure that they had a quota of taking in as many residents who could only afford to pay via Medicaid as possible. And then they also had a sort of an end of life, a charitable fund that if somebody were to run out of funds at the end of life, there were some additional funds available to help subsidize the care of someone. So paying attention to that as a funding means is good, but also generally there was a great deal of attention to the staff resident ratio as well. Also, make note that in the state of Oregon, like they are also considered long-term care. So you have this idea of residence rights, which I'll go over with you a little later, that can help protect you as the consumer, as well as in the state of Oregon, the option of bringing hospice in. Not all assisted living facilities have hospice as an option, so that's definitely something you would want to pay attention to if you were considering that. And again, the difference between assisted living and adult foster care or independent housing is the fact that there is also on-site licensed nursing to care for your some of your basic medical needs and medications. So now I want to turn to memory care. Sometimes, I know that many times assisted living facilities want to keep someone there who has dementia, cognitive decline as long as possible. But when they are definitely having some major behavioral problems, when they're wandering all throughout the building and wandering away from the building, there might come a point where a more specialized, more secure environment of care where the staff to resident ratio is very high to accommodate and care for those specialized needs exist. So that's where you would want to consider memory care. And memory care is often associated with or linked to skilled nursing care. And it then becomes usually generally 21,200 to 2,500 more than you would pay for private nursing home care. And again, you might already be familiar with rehabilitation and nursing home care, which is really the medical model of care. Most of our nursing facilities do incorporate active rehabilitation services, occupational therapy, physical therapy that's coinciding with maybe a surgery or a medical incidents, and you need that extra time in some kind of specialized unit to get you back on your feet, so to speak. That means that Medicare often covers the first 100 days, and then paying for it out of pocket can be shored up through maybe some private insurance or ultimately Medicaid if you're part of that, if you're Medicaid eligible after some spend down. And so again, this is our long-term care option and is then governed like adult foster care and assisted living in the state of Oregon by residence rights. Residence rights are federally driven, but can be kind of tweaked or modified a little bit by each individual state. But overall, when you are a consumer of long-term care, you want to just know that you have the right to be fully informed and you have the right to voice your complaints about concerns about your care. You have the right to privacy, confidentiality. You have the right to not be involuntarily discharged, to be treated with dignity and respect, to have visitors, and to make independent choices. You actually have the right to refuse medication. It may not be in your best interest to refuse that medication, but under the law of residence rights, you have that right to do so. Central, again, if you're thinking about remembering anything, central to residence rights in these three settings is this idea of the care plan. And so when you have the right to participate in your own care, but your care is driven by that care plan. And your care plan can be very, very comprehensive. It can cover everything from who you want to visit you, to this preferred social activities you'd like to engage in, to the doctor you want to care for you and what that care looks like. So whenever you have a concern, you can always circle back with the administration about what's entailed in your care plan and make changes accordingly. Again, when we're looking at long-term care facilities, often the complaints and concerns that emerge are some concerns around unexpected discharge or evictions, unanswered assistance for unanswered calls for assistance. And again, that's linked oftentimes to staff to resident ratio as to how quickly your concerns or the call bells answered, how quickly someone can get to your room to assist you. Anything around dignity and respect, proper medication distribution, and always there are most often concerns about food quality of your aeration, particularly if you're living and staying in one particular setting. The same old meal plan can get pretty boring pretty quickly. So so that is often something you could pay attention to when you're shopping around for a facility. How varied is the diet and meal offerings? If you have any concern about your care in a long-term care facility, you can always contact the facility ombuds, which should be posted in in each facility to discuss your concerns. And if you do feel that it is some sort of neglect or abuse, certainly contact Adult Protective Services for your area. Another option of care is the continuing care retirement community. And this is really characterized by all of the options: independent living, memory care, assisted living, and skilled care, and along with in-home care services when you're still at that independent stage of living. All of these services may be umbrellaed in one regional area, or at least coordinated through a series of care options. The price for this kind of care varies greatly, and it's been my experience in my interaction with continuing care communities, CCRCs. These are often the price of this care is comprehensive, and many times people will sell their homes, and then they will invest into a care package that's designed for them and specific to that particular CCRC and the kinds of services that you think you might want now and in the future. So it's really important to kind of pay attention to what that price range is, what your care options are. But this can be a really great investment. For example, I've known people who maybe don't have have a very, very minimal social network in the community, and they invest early. They invest maybe in their 70s when they're still active, physically active. They're and they want to just have their little house or their little independent residence, and they go off and they travel, but they come back to an organized social network, organized community of activities, and maybe there are two of them, and one may have, it's going to be predicted that they'll have an onset of severe diagnosis. So how nice it is for two individuals to remain on one campus where staff can get to know them over time, and the one person can stay in one level of care while the person transfers to higher level of care as needed. And then it makes that coordination of seeing each other and maintaining a relationship much, much easier. So it can be a great option for folks if that is something that they, quite frankly, can afford to do. Finally, I just want to do a shout out to palliative care and hospice, because this is a team of social and medical professionals designed to help someone at the end of life. The price range and price options will vary according to the agency and what's available to you. And again, as I make note, palliative care in Oregon can be an option to add to any kind of care if you are in assisted living, as well as oftentimes in skilled care, can also bring in hospice care at the end of life as another level of care to provide you through that time. And I know you'll go through more detail of what that looks like later on in subsequent presentations. So now let's turn our attention to some of the things that I invite or encourage you to look at when you're shopping around or considering options of care for you or other people in your community. I want to make note that finding the best option for you or people in your network, your family, friends, neighbors, is very dependent on what's available in your community. So the options of care, like the number of, in-home care in a rural setting, is not going to be the same for a mid-sized community or a large urban setting. So I just want to make that's going to be part of the reality of shopping for care. What is realistically available in my community or in my region? So having said that, again, if you're shopping for home care, uh, be sure to understand what the training of the caregivers is, what that looks like, as well as the continuity of care that's available through perhaps an agency. There's also there's a lot of information, again, on the Oregon.gov website through the Home Care Commission to help you navigate that process. In general, when you are looking at supportive senior housing, senior housing with care, and even when you're looking at maybe at the very beginning at independent housing complexes, these are the things that you want to begin to pay attention to in general. You really want to use your senses. Is the environment in which you are stepping into warm and friendly? Is it inviting? What's the noise level? Does it appeal to your senses, to your aesthetic? When you are walking in, is the community noisy or is it too quiet? What's works for you? Are the residents socializing or do they look isolated? How are the rooms structured? What is available? Are they quiet or can you hear the neighbors next door? Can you hear people in the hallway? Do you like how the environment looks? Do you like how you are viewing the interaction between the staff and residents? Do the residents actually look happy? Do they look engaged? Are they active in a way that meets, again, your tastes and lifestyle? Is the environment clean? Are the grounds maintained? Really, don't be afraid to use all of your senses. How does it smell? What do you see? What do you observe? This is your first, this is always should be the first step. When you walk in, is this a place that appeals to you? Don't be afraid to say no. If it isn't, that place is not going to be the right fit for you. More specifically, I mentioned if you're looking at independent senior housing and you're having to sign a contract for that services, pay attention to not only the costs, but also the grievance process. So if things aren't to your liking, if you need to raise a concern, where do you go? Will the response be, et cetera, et cetera. Also, pay attention to any kind of additional services that you might have to pay for and what you are allowed to bring in to the facility. And also, I would say you might go ahead and ask not only about safety precautions, but discharge policies and how they handle residents who are in need of a higher level of care than the independent senior housing can realistically provide. How do they have those conversations with their residents and consumers? What do those transitions look like? What support is given, if at all, as well as some of the other things that I've mentioned. Another thing, another aspect of shopping for care and finding the right fit is really paying attention to traditional versus person-centered care. And this is particularly important when we're looking at our long-term care options. And for more information, I gave you the link of the Pioneer Network. In the traditional model of care, namely in skilled care, even though there are residents' rights, which are meant to promote resident-centered care, the actual structure of the delivery of care is more of a traditional medical model of care. That means the facility is organized around delivery of services according to time. So everybody needs to wake up at within a certain time frame. The meal is offered only within a certain time frame. People will have lunch, will have their activities, in the afternoon during a certain time slot, and people will eat at a certain time slot, and then the staff get people ready for bed during a certain time frame. The medications are distributed during a certain time frame, et cetera, et cetera. So there's very, very little variation that could appeal to individuals. In contrast, a more person-directed care is when people are actually able to dictate in a more autonomous way when they want to get up, when they want to get dressed, how and when, what they would like to eat and when they'd like to engage in certain kinds of activities. In this kind of model, you will often see one nurse assigned to a pod of residents. So maybe there's a pod of, even visually, you might see a little nurse station and a pod of rooms structured around that versus a long hallway of rooms with the residents where the nurse's station is at the end of the hall and then everybody else is down. So a good example of a more person-directed, skilled and assisted living care type of setting is actually the Veterans Home in Lebanon. That was specifically designed and built around this idea of more person-directed care versus the traditional model of care. So if this is available to you, please consider that as an option when needed. Again, adult foster care, some of the things that come up, roommate issues, storage space, grievance procedures, and even the availability of an ombud. Ombuds, typically they're volunteers, they're certified volunteers. Usually they're first directed to visit frequently in our skilled facilities. our assisted living facilities, and then adult foster care. But they should be available and on call if needed. And generally speaking, when we're looking at assisted living, nursing home care, memory care, again, you really want to pay attention to understanding what the staff and resident ratio is. I would ask if hospice is available to residents, what that structured care of modeled care looks like. But also, you can go online to medicare.gov and look at surveys, the survey findings from inspections. Sometimes a rule of thumb in selecting one of these models of care is, if you're the caregiver looking for a loved one, is that facility on my way home? Is that facility within driving distance so I can make spontaneous visits to that facility to visit my loved one? That's a really important consideration. Are the deficiencies that are on the inspection related to the kind of care that is needed for my loved one or me? So for example, if there's a lot of deficiency in bed sores and you know that there's going to be some bed sores that need to be addressed, if you have the choice of choosing another facility that doesn't have deficiencies in that area of care, you might opt to go with the other facility. Also, make sure that I would really find a place that promotes its ombuds, the availability of an ombuds, as well as a residence council and a family council. Because again, these facilities that do so are more receptive to maybe working with you in addressing any kind of care needs or concerns that come up. And again, this idea of Medicaid bed, for example, if you're entering into an assisted living facility through private pay, are there also Medicaid beds that might be an option to you in the event that your funds run out? That's another good thing to keep into consideration when you're shopping and looking for places. Regarding continuing care retirement communities, again, I would look at the different kinds of care options that are available on one campus, how those transfers are made to the next level of care, the cost for that care, and also your budget for anticipated duration of your stay and anticipated needs, along with contractual obligations. And again, with everything, what is the staff to resident ratio? And what are the services that are going to be optional that you will need to pay in addition to any kind of obligation you have arranged through payment of services through a contract. Lastly, I know we're bumping up against the end of our time together. If you or another person are moving into any kind of housing option that includes supportive care, be sure to communicate what those care needs are and be as comprehensive as you possibly can, because your care providers don't know you or don't know your loved ones. So the more information you can provide, and you can even integrate that into not only the intake forms, but into those care plans. If it is a long-term care facility, which it most likely will be, please do so. Put that information into the care plan. And again, just a variety of things, everything from signs of what an emergency medical situation might look like, general likes and dislikes, everything from all of the assistive devices that one uses or would benefit from, possible behavioral problems, issues around mobility, allergies and special diet concerns, preferences for meals, as well as any kind of therapeutic exercises with detailed instructions. Again, be as comprehensive as possible as a way to prepare your care providers in the best way possible for them to take on that kind of care. Lastly, just I want to highlight a few resources for you. And again, you're going to have this PowerPoint presentation at your disposal, so you don't have to write everything down or remember everything. But really get to know the State Aging and Disability Resource Center because this is really a great place where you could learn about all the different programs available to help you or someone you know stay in your home for as long as possible. And many of these are not income based. In other words, they can help shore up any kind of modest income that you might have, Meals on Wheels, transportation assistance, caregiver programs. There's all kinds of things, programs that might be available to help you maintain a quality of life within your home. The Medicare Provider Compare is a very important resource that will give you information about in-home care services, nursing home facilities, and even palliative and hospice care facilities. I'm not sure about assisted living. That I'm not sure about. So forgive me for not having that. But you type in your zip code and it pulls up what's available in your community, and it also provides ratings of that care. So assisted living probably should be in there because they also are inspected just like nursing home and hospice and in-home care. They have to meet certain standards in order to be that Medicare and Medicaid provider. Dementia Care Central is just good for dementia. Anything around residents' rights, National Consumer Voice for Quality Care is NCNR is the go-to place for that, as well as your anything related to long-term care ombuds, Oregon.gov, and I put also the list for reporting abuse or learning about that. And then Pioneer Network, I mentioned, is a good resource for learning about more forward-thinking, person-centered, comprehensive medical and rehabilitation care for older adults. And then we bump back up to the Stanford Center on Longevity. And I just put that in there when we're thinking about how how Americans are living longer, often in amazingly robust ways. It's time to rethink uh, what the aging experience is like and how we maybe should be distributing our resources to kind of accommodate how we are living. So if you're visionary, if you're into understanding that and other research about the aging experience, I invite you to check out the Stanford Center on Longevity for more resources. And then going back down the list, there are oftentimes comprehensive directories around what's available for all of the care options in a region. So check out what's might be available to you. I know retirementconnections.com is really good for looking out for different types of directories from a regional perspective within the state of Oregon. Okay, I have provided you with my references, and then I just want to close with the final thoughts before we move into our Q&A portion of our time together. And that is, I mentioned the importance of finding out what's available locally through your ADRC, and that also includes the community centers, not to mention the food, meal sites, transportation services, family caregiver programs, even state guardianship services, and those kinds of support systems you can find through funds to help pay for some limited in-home care services, right? All can be navigated and learned more about through the ADRC portal. I want to encourage you to really think about your informal network of family, friends, and neighbors, maybe your church and other community groups that can create for you a naturally occurring retirement community. I have done this throughout my adult career, given the fact that I am in aging services. For example, when I was living in Lexington, Kentucky, I intentionally bought a house in in a community. It was modest, but I was surrounded by other social workers who were living in that community. So we could inform with the idea that our informal network was filled with information about what it would take to have a quality of life in older life. We could inform each other and support each other through that informal network. But this place that I found was also 2 blocks from a grocery store. It was on a bus line. It was not far. It was not far. It was 8 blocks from a hospital. So looking at a community that is age friendly should also be part of that mindset of what you can do when you're thinking about creating a naturally occurring retirement community. Unfortunately, life hits you in all kinds of directions throughout your life, right? And I was hit with the necessity of moving for a job, which was a better fit for my family, moving from Kentucky to Oregon. And then once again, I was thinking about how to build my informal network of family, friends, and meaningful activities post-retirement. So actively engaging in those volunteer activities like serving on boards to create that for, again, a community in my post-retirement years. And again, I was hit with the need and desire to change jobs because of some organizational restructuring at my former place of employment. And now I'm once again faced with how can I create within my new state of South Carolina an informal network? And I use all of that in addition to the example I've shared with you about my son having those conversations of what I am willing, where I'm willing to go in later life if need be, being proactive about what that could look like with him as a way to just say to you that there's a tremendous amount of value of engaging in conversations about how and where you would like to live in your elderly years, including how you would like to receive help when needed. Knowing that most likely you might have to adapt but the fact is, when you engage in those conversations, you gather information, you can create different images for yourself. So when you are in that position of having to adapt, you, I think, will be in a better position to do so. And in my mind, that's resilience. And we know that resilience, again, is also linked to a really great or better quality of life over our life span. So those are my closing remarks to you. And I'm going to stop. This is my contact information. You're very welcome to send me an email directly or even call me on my office phone. And I'm happy to take any direct calls from you if you have more questions or would like more information about what I have been sharing with you this evening. So I'll stop my share and invite you to ask questions. Oh, and if you'd like, you're welcome to put on your camera.
Hmm.
I know I gave you a lot of information. It's complicated. It's just like when, in my mind, it's like we're older, we're maybe in some kind of cognitive decline, or we have less energy or whatever. And just as we're ending our lives, the complexity of how we might need to live and be cared for oftentimes becomes more complex. So the irony of that has never failed me, and you might feel the same way as well. And it's not so easy to find the information. I find I was trying to find just some titles of the social models of in-home care, and I felt it was kind of hard to find. It was much easier to find the medical models because all I had to do was go to Medicare.gov and type in the zip code, and everything pulled up. So anyway, I'll stop chatting and take your questions. And I think is it Jeanne?
Jeannie, Jeannie.
Jeannie.
Yeah,
Yeah.
I really and I really wanted to highlight your a couple of things that you started with and ended with about what's important to you in your life, and you started with social networks, as that was one of the first things on your slide. And lately, as I've been getting stories from people about care they tried, what they liked or didn't like, and so on, or problems they had finding out what they wanted, that idea that social network or is sort of related to what's important to you, in a sense that it's not only what you do socially, because we learned a lot about that being in the village, um, is also your creative activities, or the
Mhm.
things that most matter to you, and how are you going to adapt those in each place you live, because we have to get used to change. I
Yeah,
had something sudden happen to me, but it occurred to me, a sudden change in my living, but there was time to adapt because I started talking with that with my sister and daughter. And I'd already been thinking, I went to a housing fair in 2014 here in Portland that talked about, be ready for what's your next housing, and we got a clue. We get a clue about what we might face as what you call adaptations, but we also um, don't know, but still some of those things are really the same. So would like to see more about the social, being not only social, but your individual self-expression. If you kind of
yes,
can get used to knowing what that is, so you know you can change everything else, but this is what you don't want to change.
absolutely. I couldn't agree with you more. We definitely need to pay attention to what, you know, in when we look at the literature, they're often called meaningful activities. For me, it was like volunteer work. Oh, I know I need to be headed that direction. So I'm building my network, my foundation for that. And then, of course, I had to change for jobs is more important in this stage of my life. But definitely how you like to spend your time, what gives you pleasure, what gives you meaning, making art, being creative, et cetera, et cetera. Not everybody needs folks around them. But we do know that when people are living alone in isolation, that can be a negative health indicator for many. We know that if people are around others, they're more likely to eat more. And if you're not around people, you might eat less and become malnourished. So just paying attention to the opportunity to engage with others, I think is very, very important. And I think I was looking at the 2023 census data. 28% of people 65 and older live alone. And that's a significant number. And just because you're living alone doesn't mean you are alone, but it's just something to pay attention to because more and more of the literature in gerontology is really showing how much of a contribution being socially interactive is to the quality of our life. It's almost like a health indicator. It's a contributing factor to being healthy is having the opportunity to be socially engaged.
Thank you.
Robin, should
Yeah.
one of a couple of comments from the chat.
Sure. Would you read them to me? Because I'm
Yeah,
really,
that's fine.
I can pay attention
That's
to,
fine. Yeah.
but
So
highlighting is important.
one person said the dollar figures quoted are definitely lower than they've seen in the greater Portland area.
Yeah.
And then I put in the chat the link to the Pioneer network that you cited, although
Okay.
as you pointed out, people can get that off the PowerPoint.
Yeah.
I also mentioned that the village is going to host a presentation next month on the ADRC. We're going to have somebody who's going to come
Perfect.
and actually kind of walk folks through that and, make that, talk about it. And a bunch of thank yous and somebody's here as a proactive approach for aging parents and appreciate your amazing content. Thank you, thank you. So that's what's in the chat so far. I don't know if anybody else wants to raise their hand, ask questions. Still have a few minutes if anybody
I
has.
see Pat maybe and Lynn. So Pat first.
Pat, you have to unmute.
There, finally. Okay. My husband and I have a friend who moved into a facility that was a continuing care facility that was run by a church.
Mhm.
And then after she moved in, the church sold it to a corporation that said, okay, we're not going to offer assisted living anymore. It's only independent living. So what kind of contractual protections are there for people when they move into a facility to know that they're getting what they think they get when they move in?
I know. Boy, I'm not a lawyer, so I don't have that kind of expertise, but I come from the ombuds world, the long-term care ombuds world, and if it was an assisted living facility, it's governed by residents' rights. And I'm thinking that there might be something around around the invalid discharge that could be advocated for. You might make note that oftentimes Oregon, well, all states have elder law services. I don't know what the name in your area is, but there are legal services for people 60 and older. And I would contact their attorneys to find out what the legalities might be for this sudden change and what the consequence for the residents in the facility are. If there's any kind of financial compensation, something like that,
I'm
because
also wondering when people
Yeah.
move in, like if my husband and I were to look at a place and say, okay, we want to move in here, that would be
Yeah.
the point at which we need to know that we're moving into what they say we're getting. Is that the
Absolutely.
protection?
Absolutely. So I would just really look over the contract, maybe discuss it with someone with legal expertise, because I am not familiar with the breadth and the depth of those contracts. I just know they're complex. I know that it's expensive care, that people are really making an investment when they move into CCRC, particularly at the onset of independence.
Yeah, Pat,
Yeah.
I'm just going to jump in. I put in the chat. I don't know if you saw it, that there was I think it was just the past weekend that the New York Times had a whole article about this.
Oh, I need to look.
Horrifying, actually. And in fact, you as a consumer generally don't have a lot of recourse. So I will try to dig up the article and share it with the village this week. But
Great.
pretty distressing, actually. So,
Yes, it can be very distressing for sure. Absolutely. Lynn, I think you had a question. You're on mute.
Along the same line, and I had read the article that Terry has referred to. I have a friend who's 95, and she's been going through issues, both legal and financial. And I think it's imperative that we understand our financial situation
in relation also to the legal. And no, I appreciate the comprehensive way you've presented this. We need to be looking at where we're vulnerable
Yeah.
financially, and we even now see that well, we're going to have Medicare, but we may not have Medicaid if we read the news.
Yeah. Yes, and I wholeheartedly agree. And I think that's why you're also good about gathering information now, because then we have the time to absorb it. We gain familiarity, and this is in a certain comfort level. It's not because the delivery of care is not perfect. So we have to know, we have to just do our due diligence to find out what can work best for us and for the people that we're caring for, because it is complex and it's not perfect, and our needs change over time too. So if we have the information, I think that it helps us to be more adaptable as well.
I would suggest that our relationships in the village should be supportive of this. Frequently, when people are in a financial difficulty, they feel embarrassed and don't want to mention it. And the person in New York had done their due diligence, extensive.
Mm-hmm.
And so I think I see this as something we don't just take alone, but that we share with each other. And also at some point get public about what needs to happen, but so that we don't go down one by one.
I would really like to see that. I wish there were more opportunities to talk about it. And I am scared about the boomers retiring and having adequate funds. I look at my own, and I was like, oh, I no longer have enough money for private to pay for basic assisted living if needed privately. It's just that life happens, and I was like, well, maybe I could save for 15 years, so in my mind, I'm like doing different kinds of numbers already. And we just don't have these conversations. And I've been throughout the time that I did spend in aging services, we would inform people about the Medicaid spend down program. And people were shocked at how much care or, long-term care costs, and how little you can actually have on your own. I think it's 2,000 and some, money for funeral and so forth on Medicaid. You have to be impoverished before you're eligible for those Medicaid dollars for long-term care. And people really often underestimate what those real costs are and what it means to be on Medicaid. And then we have to get creative, like you're going to have the ADRC come in. So then we start to have to get creative about how can we supplement our financial situation with other kinds of programs, if we don't have, the cash, if we don't have the income. So I wholeheartedly agree. It would be really great if it were a greater dialogue, but it's just, growing old has been marginalized in our society. It's not something that everybody always wants to take a look at. So it's often not part of our everyday conversation. And that's kind of what I wanted to get at the beginning when I intentionally have these little tidbits of information with my son. I'm trying to make it intentional for him, with him, so that it becomes more comfortable later on. Any other? I know, Terry, we're reaching the end of our time.
Yeah, Suzanne wants to make an announcement. Suzanne, you're muted though. You're muted, Suzanne.
Okay, first of all, I'd like to thank you, Robin, for this wonderful overview of all the things involved in housing options. It really is a wonderful source that you have given us, many points to think about, and sources to help us think about those things. So thank you very much. I'd also like to mention that our next presentation or event, let's say, it's not a presentation, is going to be conversations, which is something that you actually pointed out, that we need to have these conversations. And that's going to take place on Tuesday, February 11th, an opportunity for us in the village to meet at the church in small groups to talk about the kind of housing we have now, what makes us happy with that housing, and what we would want to look for if we need to change our housing, and if there's anything that we might be willing to give up or have to give up. So that is going to take place on February 11th, and we hope that many
Nice.
of us will sign up for that, and it will be a kind of follow-up for what you have presented, Robin.
Perfect.
Yes.
Well, I think Terry did a great job planning out the series of presentations.
Yes. Yes.
I want to just interject, it's a whole team effort. It wasn't just me. There's several people on the call who were involved in planning it and are continuing to, so.
That's great.
Including Suzanne,
Yes.
team effort. Any other final, okay, oh, Pat is asking how to get a hold of the checklist. So, again, Robin's gonna send me the PowerPoint, and I think.
You
what-
have it, Terry?
Yeah,
The
I have
PDF?
it, actually, sorry, yeah, I have the PowerPoint, and so I'll put that in the weekly update, so you can just be able to click on the link, and that will give you the access to it, so. And I'll also put the recording, this is gonna be, I think some of you know, or most of you know, we have a YouTube channel. And so I will put that in the weekly update too, a link to our YouTube channel so that you can come back and if you want to listen to this presentation again, you can do that. And look at some of the other presentations that we have, because we've had several different speakers on different topics, not related to housing, but just, in general, that might be of interest to people. So, yeah, I think that's it. And just want to thank you myself, Robin, for doing this. And, especially given the time difference, it's like 3 hours later for you. So, after a full day of work, we really appreciate it. So thank you so much.
You're very welcome and best of luck to all of you. And the village sounds like a great place, and it's exciting to see that you're all part of it. So thank you again for the opportunity to spend some time with you. I appreciate it.
Thank you.